Hi, I'm Nancy Blotner. At Caldwell University, we believe that all citizens should be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Comfort and care at the end of life, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. The Healthcare Foundation of New Jersey, founded by the Jewish community. Summit Medical Group, a multi-specialty medical practice providing comprehensive care from birth and pediatrics to geriatric care, concentrating in general wellness, cancer treatment, disease management, and behavioral health. MD Advantage Insurance Company of New Jersey. Caldwell University. The Russell Berry Foundation, and by New Jersey Resources. Promotional support provided by Commerce and Industry Association of New Jersey, and by Jaffe Communications, where business, media, and government converge in New Jersey.
Welcome to Caucus. I'm Steve Adubato. Check this out. New Jersey spends the most money in care at the end of life, ranking last in the use of hospice and palliative care. Here in the studio to talk about the complex and often deeply personal topic about planning for the end of life, we're joined once again by Dr. Charles Vialotti, Medical Director at Villa Marie Claire Residential Hospice. State Senator Paul Sarlo has been with us many times on State of Affairs, but today he joins this discussion. He's chairman of the Senate Budget and Appropriations Committee in New Jersey. Kathy Taylor, board member at the Goals for Care Coalition of New Jersey. And Bob, say your last name?
Orozovich.
Because I wasn't going to make that mistake. Okay. And Bob is a volunteer at Villa Marie Claire. I want to thank you all for joining us. By the way, for those who do not know, even though we've done programming about Villa Marie Claire before, tell us what it is, Doctor.
Villa Marie Claire is a residential hospice located on 27 acres in Saddle River, New Jersey, sponsored by Holy Name Medical Center. It's unique. It's a hospice facility that serves the needs of patients from every hospital, every nursing home, every location throughout the New York, New Jersey area. We are unique in that we are able to accommodate 20 patients, all in private facilities, and we have 12 guest rooms where patients' families can stay at no cost. It's a very, very comprehensive care center for end-of-life care.
You know, as we put up the website for your organization, imagine a lot of folks watching right now on public television, Vios, listening on the radio, other places, like, I don't want to hear this discussion.
Yeah.
Why is Steve Adubato talking about the end of life? Why can't the end of life just happen?
Those are very good questions. The group that I'm here representing, I'm a board member of the Goals of Care Coalition of New Jersey, and one of our main focuses is to encourage conversations at the end of life that don't happen, because they're very difficult to have these conversations.
What does the conversation sound like? And you're actually, we're talking about talking to those in our families, those who are loved ones. When's the right time for that conversation?
Certainly, there should be a conversation for those with serious illness, those nearing the end of their life, but it should happen far before that. One of the aims of our group is to increase advanced care planning in the state so that people, even those who are healthy, are able to have these conversations with their physicians, other healthcare providers, and actually document what their wishes might be. We call it the 3 Ds.
3 Ds are?
You have a discussion with your physician, with your family. You make a decision about the kind of care you would want. Would you want aggressive care? Would you want less aggressive care? Do you want to focus on quality of life? And then you document that.
You put it in writing?
Yes.
Senator, let me ask you, I started out the show by saying we have the highest cost of any state in the nation when it comes to end-of-life care. Is this part of the problem that the conversation is not taking place?
Yes, and before I go there, I agree with you, quite frankly, because when my staff reached out to me and says, do you want to learn about end-of-life care? Do you want to go visit Villa Marie Claire and learn about hospice? I said, not really. That's not a discussion I want to really have. And so many other areas that I want to learn about as a chairman of the Senate Budget and Appropriations Committee. But when you actually go there,
What did you see?
And see Dr. Vialotti and his team and learn about it from Mike Marin, and you see the compassion, the 24-hour care, people with their families, not in a emergency room or in a hospital where there's a lot going on. And you see the compassion of the people that are taking care of you on this estate, this beautiful estate with landscaped and rooms for the children. It's like, okay, I get this now. But those are decisions that can't be done quickly. Those are decisions you have to begin to have as a family. And that's stuff that I'm still learning about as I support these programs.
And by the way, to be clear, there's a $3 million state appropriation that you sponsored to support the efforts at Villa Marie Claire, correct?
This would be the second appropriation. There was a $5 million appropriation, and then in this last fiscal year, it was a $3 million appropriation that I was able to convince my colleagues to support. And that $3 million goes directly to the Villa Marie Claire.
Bob, explain your connection here as a volunteer. Your sister.
My sister passed at the Villa in March of last year, and I was a volunteer 4 years before that. But she had end-of-life Parkinson's disease, and she was guided along the way by her physicians as to how the disease was going to progress. And so right up until the doctor finally said, you're going to lose the ability to swallow. And sure enough, she did after a few falls, broken ribs, and she never did bounce back from that and lost the ability to swallow. But the doctor also talked to her about what was going to be her next step. And it was going to be hospice at that point. And she didn't recommend a feeding tube or a PIC. And so when that happened, my sister very emotionally knew where she was going. She had a friend that had passed there a couple of months before, so she was aware of what we do. And plus, I volunteer there, so she knew what kind of care she'd be getting.
What was that family discussion like?
It was tearful. It was she finally, she was on board with the decision, and all my siblings and my wife were on board too. But which we don't always get that. We don't always get that where you could have 5 people in a family and 3 will like it and 2 won't.
Charles, let me ask you, Dr. Vialotti, and I see you shaking your head. You jump in here as well, Kathy. So I said it was a difficult conversation to have, even if people agree.
Yes.
What happens in a family? You bring this up, doctor. And there are very different views as to what the end-of-life care should look like.
It is difficult, but I think if we can spend time with each of the different factions within the family so that they all understand...
Now, factions, you were not simply talking about Italian families.
Well, very often.
Could be any kind of family. Just check.
Yeah, but if we can educate them separately and then together, I think we can come to a resolution.
Define educating. I mean, that's what we're trying to do right now, by the way, but go ahead.
I kind of explore what they understand about what their loved one has been saying, what they understand about their loved one's illness, what they personally believe, whether it's religious or spiritual kind of thing, whether it's cultural. We try to explore all these things, and very often we can dispel the myth. Hospice is not about dying. Hospice is about living.
Explain that.
It's about, well, they used to say hospice offers people death with dignity.
Yeah, I just heard my notes say dying with dignity.
Yeah, and that's true, but that's a moment in time. Hospice is a time to give up often toxic, no longer effective, isolating, toxic treatments and focusing on quality of life treatments. Treatments that will support the patient, meet their needs, make them comfortable so that they can enjoy their final days, weeks, or months.
But that just doesn't happen if you don't have these difficult but
conversations.
critically important conversations.
And a large part of the grant that we've gotten from the state is going toward not only educating physicians, because they're a big part of the problem about these conversations not happening. Oh, absolutely.
That physicians
are reluctant.
Many, not all.
No,
but
many
Too
are
many.
reluctant to initiate at an early time. But rather than just using the POST, which is a wonderful document that we have now online, that a person...
What is it?
POST is a physician order for life-sustaining, treatment. And individuals might sign one, but that's just a pre-printed document with a signature on it.
You got to get into the details.
You got to get into the details. And what we're doing at the Villa is setting up a room where people can come
Wow.
and video record their wishes.
And that's partly from the state grant. Jump in,
Yeah.
Kath.
This is so important because you're talking about people who are, I mean, none of us want to die, but ideally, dying in a hospice is one of the best supportive environments to be in. But in order to align patients' wishes with the treatment they get, we really do need to make a big change in the way physicians and patients communicate.
Explain to us what could be an issue and what needs to be
Well,
a
one
better
thing
way,
that our
in your
coalition
view.
does, which is, by the way, it's a coalition of hospitals, providers, all not-for-profit groups,
Sure.
13 groups, is now we have some resources on our website. How to have these conversations.
Your site's up right now, but go ahead.
Because what happens is physicians and patients don't, if the physician isn't broaching the issue of what would you want at the end of life, it's just diagnose, treat, diagnose,
But isn't that, I'm sorry,
treat.
but I'm sorry for interrupting.
Yeah.
We've had many physicians who are trained that to do no harm, and therefore my interpretation, and then not just me, but many others watching is, so I'm going to keep you alive as long as I can. And that's the opposite of what we just.
Well, no.
Well,
Go ahead,
that's
Paul,
why
jump in.
they have the diagnose, treat cycle, because they don't want to look at the longer-term care.
But aren't those physicians, devil's advocate, reflecting the wishes of many of the people that they're taking care of? And it seems to me you're saying that physicians need to lead the conversation and bring it up, even if a patient and his or her family don't want to talk about it.
Yes.
Which is what
Yes.
my sister's doctor did. As her disease progressed, the doctor was saying, this is what's going to happen at this stage, and this stage, and this stage. And she prepared her, and she said that at one point you're going to have to go into a hospice. And
The
much to
physician
her
did
credit,
that.
yes.
Senator?
What I've learned, these are folks who are terminally ill and are in a hospital, right, where physicians are doing everything in their power.
That's right.
To keep them alive, okay? They're terminally ill patients. But the conversation is not, and this goes to the cost impact, and it's a difficult, right? So
Explain to folks how there's a cost involved.
Our Medicare and Medicaid rates of being in a hospital are, quite frankly, extremely high, much higher than the rates, and he'll
Right.
give you the rates over
Right.
at his facility, are much higher. The physicians and the docs are doing everything they can to keep those. This is not an aid in dying bill. This is not an aid in dying. This is about keeping those folks alive as long as they can. But unfortunately, they're in a hospital in a very difficult situation where there's a lot of trauma and drama going on, and families don't have as much access to them, 24-hour access. So by encouraging them, still get the same care, still getting the same care, the same love and care, they're
Right.
going to do it at a much cleaner, much nicer facility, a much more facility compassion. Trust me, this was a very difficult thing for me to learn about.
I'm going to put that out
I'm a
there,
little
Paul.
younger than you, and I did not want to learn about this stuff.
And I'm a little bit older than you, and I
Yeah.
didn't either. And I'm going to put this out there in this way. I actually really wrote down about my fear. And by the way, when I talk about myself, I know I'm representing many people watching right now on many platforms. So if your thing is, particularly if you have we happen to have young children. I know you don't have to have young children, but you think about your young children, and you're like, I don't want to talk about this. I don't want to think about. I knew we had to do this show, and it's got me thinking about these things because we do have young children. You want to be there forever, which last time I checked is not a possibility, right? You're actually talking about preparing while living for how you want to pass on if you have any influence or control over that. Charles, am I have this right? Or I'll come back together.
You're absolutely right. But I think that you're giving your children and your family a gift.
That's the gift?
That's the gift.
To
when
talk
you
about
tell
it?
them what you would want if and when the treatment for your particular illness was no
There's someone in
longer
her
effective.
50s and 60s, and like, let's bring this up. You're relatively healthy. Let's talk about this. Really?
Yeah, and you'd be amazed at how relieved people are when the person themselves has given an idea of what.
So now I don't have
what
to
they-
guess what you.
You don't have to guess. You don't have to feel guilty if you decide not to do aggressive treatment. But more than that, we find very, very often that the person who has made this decision to do this,
Sure.
and the data is very clearly published, that people live longer, they have greater satisfaction with their lives, Their families cope better with the eventual
Once they
loss
talk
once they
and
talk
decide.
and do palliative care or hospice care sooner. They actually live longer.
Doctor, stay right there. Everyone stay right here. I promise we don't do commercials for this, but we'll keep this discussion going on end of life right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, Ph.D. And follow us on Twitter at Steve Adubato.
Welcome back, folks. Steve Adubato here talking about end-of-life issues. Kathy Taylor, jump back in. You were saying, as Dr. Vialotti was talking about, listen, you potentially live longer, better quality of life, take pressure off your family when you have the discussion and make the decision as to how you want to pass on.
Absolutely. One thing that I do is do ethics consults in hospital, and we're brought in when there are cases, oftentimes, where we have no idea what the person's wishes are.
You have legal training?
Yes, I do.
Okay.
I'm a bioethicist. But we come in and we talk to the family members. Oftentimes the patient at this point can't talk.
Right.
And the family members don't know what they would want. And it's very tough to be a surrogate decision maker and not have any idea. You can guess, but not to know what the family would want.
Sure.
I saw a patient come in. She had been in a nursing home for months, and then she became critically ill. She came into the hospital, and she had no advance directive, no pulsed, as Dr. Vialotti was talking about, no kind of guidance as to what she would want under these circumstances.
Right.
So you're doing your family a favor, you're doing yourself a favor. And one thing that the Goals of Care has on our resources on our website is a guide to have these conversations. Instead of do, diagnose, treat, it's a 4-step approach.
How to do it?
Diagnose, discuss a diagnosis, discuss prognosis. Within that context, what are the patient's goals of care?
Right.
And then you make your decisions based on the goals of care so that you get, as we say, the care that you need and no less, and the care that you want and no more.
Well, you know what's interesting about this? I'm always reluctant to talk about this, but my dad, as we speak right now, has not really been able to communicate. And as Paul, who has known my dad for a lot of years, communicating.
Sat across him many times.
and communicating.
And he told me how he felt.
Yes. But it's been about several years that he's been unable to communicate and had real cognitive issues. And so I know that discussion never took place. And I talked to my mom, and she's like, well, let's not talk about it. But should that discussion have taken place? I'm not, again, Mom, I know you're going to be mad that I did this, but should that discussion have taken place 10 years ago before he's 85 years of age?
I believe it should, because when
But he was not suffering from any cognitive issues at that time.
No, and again, hospice wasn't as big as it is now.
Yes.
I shouldn't say big, but
Prevalent.
But prevalent, and but once that decision is made, I see people that come in, and it's an overwhelming process, even when the decision is made, that the families can be, did I do the right thing? Did I not do the right thing? But then once they see the care that they get at the villa, that's slowly goes away.
Sure.
Yeah. And
The economics here, I'm curious about this.
I mean, clearly, listen, I've been stressing to my colleagues, educating and informing a little bit. So the Villa Maria is one of the few facilities that we actually have.
There are not many, right?
There's not many. There's a handful.
Yeah.
This is probably one of the largest, and
absolutely.
And it's unique in its own way, as the doctor.
Our holy name is an underwriter of what we do. I want to disclose that. So go ahead.
So it's one of the few that we have in the New York, New Jersey region. But from a cost standpoint,
a lot of people here.
Well, a lot of people. From a cost standpoint, when you actually talk to what the cost is to the state of New Jersey through our Medicare, through our Medicaid rates for people who are terminally ill and who are dying in a hospital, and these are folks who can't go back home, compared to making the necessary arrangements and having these discussions, as these folks have said, and moving them to the Villa Maria or another type of facility. it is a much more cost-effective way as well for the state of New Jersey.
Okay, but hold on a second. New Jersey, as we said in the opening, spends more money than any other state on end-of-life care. So my question, Doctor, is, are there certain other states that are, quote, doing it better? I don't want to say better.
Nobody does it better than New Jersey. But
well, nobody does a lot of things better than us, including our high property taxes, but that's not where we're going here.
Right.
But are there other states that, in terms of public policy, in terms of laws, in terms of what is there something?
Yes, I think there's been a culture here in New Jersey where physicians and healthcare providers have not been open to this discussion.
It's part of our culture.
It's part of our culture, and it's very hard to change culture. I think it's very hard to change culture. But we're working very hard to do that, and we're seeing definite changes. We recently had a 31-year-old woman admitted to the villa.
31.
She had graduated from Princeton, first in her class, and a month afterwards was diagnosed with a terrible illness. And she had two goals at this point. One was to be a witness at her good friends' weddings, and she wanted to be home so she could go to that. She was too ill. Her parents brought her into the villa, and 3 or 4 days later, her friends were married in the library at the villa, so she could witness.
Your place?
Yes. And the next day was her 32nd birthday, and her family had 40 people there. They had a musician, they had cocktails and hors d'oeuvres in the new family room at the villa. She was all dressed up, she had flowers in her hair, she was sitting there enjoying her birthday. And the joy that she expressed and the fulfillment that her parents and her friends experienced was phenomenal. Had she remained in the hospital, she would have been in an ICU or in a semi-private room with crowds and none of this pleasure and
But hold on,
enjoyment.
Doctor. She chose at 31 years of age to take the initiative and say, let's talk about this?
She had an autoimmune disease that could not be cured, that was causing her terrible suffering. We controlled her pain, we controlled her anxiety, we supported her family, and seeing them celebrate these two events.
I wrote the word, it's interesting, sorry for interrupting. I wrote the word peaceful.
Yes.
Am I, is that not the right word, Bob?
No, it is. Peaceful is the word, serene. I always tell people, and I believe this, that from the time I get out of the parking lot, in my car in the parking lot, something puts its arms around you and guides you in, and it's
As a volunteer there.
as a volunteer, and I try to bring that to the people who are in there with their families, that it is a peaceful place, and they didn't come there to die, they came there to live out the rest of their life.
I was there the day I was there, we had the press conference to announce the money. I was
The state appropriation of $3 million.
I was talking to the staff who does the cooking there, the chef, and he explained to me that he had a family there one time, and of course they were under a lot of stress and devastated that they were going to lose their loved ones, and they were hungry. They were going to go out to get some Italian food. And he said, don't go anywhere, stay here. And they wanted chicken parm, and he went out and made them a home-cooked chicken parmesan meal. They got them a bottle of wine, and they sat in the library and ate with their loved one, a home-cooked meal. The chef made it for them because they wanted to, instead of running to a restaurant, they wanted to be there. That doesn't happen, unfortunately, in a hospital.
No.
So interesting. Yes, jump back in.
We have to move up the pipeline. We have to get there earlier. Physicians who treat seriously ill patients or elderly patients, geriatricians, nephrologists, cardiologists, I think have an obligation to bring up these issues with their patients.
Are they trained to?
As they start to go downhill.
Yeah, but respectfully, sorry for interrupting, Kathy, but you're saying they have an obligation. My question is, even if they have the will, do they have the way?
Well, that's one thing that our group is trying to change, is to provide resources. We have this four-step approach that I described.
We talked about, right?
And online, the providers can also get guidance about how to have these conversations using the four-step approach. It's very scary to have these conversations, even when you're a physician or a nurse. But it can be simpler than we think if you have the proper guidance on how to do it.
Real quick, in the few seconds, we have moments I have left. I have a living will. Is that enough?
It's enough if you've chosen the right healthcare proxy.
I haven't. Well, healthcare proxy, what do you mean?
A healthcare someone who can carry out your wishes in the event that you become unable to speak for yourself. And the reason I say that, too often people pick their closest relative, a wife, a husband, a son, or a daughter.
And what's wrong with that?
Well, maybe emotionally they're not buying into what your living will states, or maybe they're not strong enough to respect your wishes. And sometimes you should choose a person who you know will respect your wishes and will do this, so that you know. And this is part of what we're trying to teach people now, too, as we go out into the community. We are trying to educate physicians, but also the lay community. We're reaching out as part of the grant to try to increase the importance.
Using the state dollars to educate,
to all this,
create more public
so that
awareness.
more public awareness, because the public can drive
That was part of the requirement as
referral.
well.
2
for
seconds
them.
left.
Yeah.
Part of the requirement for them to do the outreach and the public education, and also to compile some data for the Department of Health and Human Services, to compile some data on the use of the facility.
Let me say this. We cannot thank all of you. I mean, we can thank you for your public service because you're in the Senate, but we can also thank the rest of you for being a part of this conversation, which may be uncomfortable for you. I know it was for me, but is no less significant and important. I want to thank you all very much.
Thank you. Thank you for the opportunity.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by New Jersey Sharing Network, the Healthcare Foundation of New Jersey, Summit Medical Group, MD Advantage Insurance Company of New Jersey, Caldwell University, the Russell Berry Foundation, and by New Jersey Resources. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Hi, I'm Judge Michael Giles. As a trauma surgeon, my son, Randy, saved lives every day of his career. When he unexpectedly passed away at the age of 43, Randy continued to save lives as an organ and tissue donor. His organs saved 5 people, and his tissue restored health to more than 50 others. The New Jersey Sharing Network was with us when Randy gave the gift of life. They are committed to saving lives through organ and tissue donation and educating the public about the importance of donation and transplantation.